Well, let's imagine better health this morning. CHI Health has more primary care physicians than anyone in the area. So how many? 114.
Wow. Health experts will tell you the need for primary care physicians, it's critical. These doctors are invaluable for us individually, but also making our communities healthier.
Sure are. That's right. Dr. Carlos Brendes works in family medicine. Doctors, thanks for stopping by
Nice
this morning.
to meet you.
Thank you. Nice
So,
to meet you.
as a primary care physician, and I think people underestimate the value of primary care physician and the impact they can have to your overall health. Who should come into their primary care physician and how often?
Well, in a perfect world, I think everyone has their own primary care physician. Pediatricians, internal medicine, family medicine, some women use their OBGYN as their primary care physician, but it helps to have that relationship where you can go, and that's your medical home. So I think everyone should have their own primary care physician at all ages.
Because you have access to the whole family history, I guess, the health history in a way, if you're saying parents and kids and generationally,
of course, yeah.
Does that affect how effective you can be in treating your patients?
Oh, for sure. We have access, I mean, with electronic medical records now that are ubiquitous, we have access to every test that's been done. And so we can look and see what happened at the visit in the emergency room when someone fell, or if they went to urgent care, or we can keep track of, when was their last tetanus shot. And we can help to coordinate those tests and hopefully save them time and money and make their stay more efficient and get them on with their lives.
I think that's a great point, the efficiency and getting in, cost is one thing rather than going to see a specialist, but then getting in quickly. Why is that? Why are patients able to get into their primary care physician a little bit quicker?
Well, most primary care docs are going to keep openings for same day for SIG visits. If it's something you're scheduling out, like a well child check or a physical or a routine med check, those can be set up in advance, and it can be as convenient as your schedule would allow. But we try to keep openings for same day visits because we know that life isn't always predictable. The kids get sick. Sometimes you can only miss a half a day of work or don't want to miss work at all. We can do the best we can to get you back up and productive.
With chronic conditions, I'm thinking about like diabetes and what comes along with that, or heart disease and what can come along with that for patients. How do you approach those situations so that you're helping them maintain their health?
The best way to stay healthy, the best way to manage your chronic medical conditions is to stay ahead of them. And with your primary care doc, that's the easiest way to do that. You have that relationship. We know what medications you're on. We can help you with the monitoring of blood sugar and blood pressure and cholesterol, and make sure that we're doing the tests necessary to make sure the medications are being used safely. We're helping to keep track. Are there other things going on in your life that might be affecting how your health is? And in primary care, we're acting as your advocate if there are specialists that are ever involved, trying to help to coordinate the testing that's done, helping to coordinate where you're going and who you're seeing, also trying to help be a cheerleader, trying to cheer the victories. I had a guy in yesterday who 6 months ago I said, hey, you got high blood pressure, let's put you on this. Maybe try cutting back on the soda. Well, he did that. He's lost 50 pounds, and I got to take him off his blood pressure medicine yesterday, and that was a great victory.
That's awesome.
So.
Well, those conversations are important, especially when it comes to the preventative side of medicine. And so 90% of your patient's issues, you can deal with them directly, but what about the smaller percentage of patients that you maybe can't help in those situations, that other 10%?
Well, like you said, 90% of what comes through the door, primary care docs, myself, we're all comfortable taking care of. We can help you as well as the specialists. Now, that being said, the specialists have a skill set that they have training above and beyond what I've done and what other primary care docs have done. It's our position to help recognize when we're kind of running up against those limits, things that are a little bit more complicated. And the specialists, they want that kind of almost screening to get the patients that need their help in there faster. And if we can help take care of the more routine, the day-to-day, the not simple, but things that are more expected, they can take care of the more complicated cases, which is why they did the extra training in the first place. And then we're there to help coordinate where they're going, who they're going to see next, sometimes translate what happens back into English so they have a better understanding of what's going on with their health.
And patients appreciate that. The translation back to English, we do appreciate that.
Is there any evidence that having a good relationship with a primary care physician can keep you healthier longer, can sort of extend your life to some degree as you're, because I mean, I feel like it's maybe a big question, but it's common sense to me if you're taking better care of yourself along the way.
In areas where there's better access to primary care, you end up with lower overall costs. You have fewer visits to the hospital, fewer visits to the emergency room, and that would translate into fewer hospitalizations. Where there's more primary care, there's more preventative care available. And with preventative care, then maybe you don't have the heart attack or the diabetes doesn't get out of control. You avoid dialysis down the road.
Right, I mean, it feels like, you don't want to overstate the potential here, but it makes a lot of sense.
Yeah, you really want to get ahead of this stuff. And so, for more information, you can go to chihealth.com. You can find a primary care physician under that Find a Doctor link, and you can also find someone close to you under the locations and directions section too.
They make it really easy. Like it's sort of like you have no excuses. Just take care of yourself. Doctor, it's great to meet you.
Thank you. Nice
Yeah,
to meet
Thanks
you.
for being
Doctor.
here.
Appreciate it.
These two realize they're working out at the same gym at the same time.
Yeah,
I'm sure you run into each other
I've seen it
down
a
the road.
million times probably.
Next, schools and ozone, the concept behind